Okay. Hey, my name is Mimi, and this is my poster presentation. Um, I'm going to share my screen so you can see my poster that I created. Okay, here we go. So, I did my research project on childhood exposure to intimate partner violence and PTSD. So, brief introduction. In the US alone, intimate partner violence affects between 2.7 and 13.9% of women and 2% and 18.1% of men annually. So more recent studies reference domestic violence as intimate partner violence. um, but like these two terms are pretty much interchangeable. Um, so first responders and primary care physicians have also reported survivor prevalence rate approximately between 12% and 45%. Not only does intimate partner violence affect the victim in the relationship, but the abuse also impacts the child or children in the environment. Children that are exposed to intimate partner violence pose increased levels of anxiety, which may lead to symptoms of PTSD. So, the purpose of this poster is to question the correlation between post traumatic stress disorder, PTSD, and childhood exposure to intimate partner violence. So, the research question: is there a correlation between childhood exposure to intimate partner violence, IPV, and post traumatic stress disorder, PTSD? Based on the observation at my placement, that some toddlers and young children may scream or exhibit anxious behavior when their mother leaves for a brief period. There is empirical evidence derived from various studies, as well as biological, psychological, and social approaches that provide explanations for the observation. So, moving on to the lit review. Post-traumatic stress is a psychopathological outcome resulting from exposure to a significant event that threatens the life or integrity of a person or their loved ones as they witness that of others. So, from a biopsychosocial perspective, offspring of intimate partner violence victims are potentially predisposed to certain psychological diagnoses, such as PTSD, the mother may have developed during the pregnancy. So these are considered intergenerational effects. So, regarding the research question, a child's attachment to their primary caretaker has um, a, a big effect on their development. Um, since the child's attachment to their primary caretaker is often associated with an abusive environment, any uncertainty about the caretaker could pose a threat or concern to the child. And this kind of ties into attachment theory, um, and the sense that, you know, um, a child's primary caretaker takes on that role in the child's life, and that's how they learn to make first knit tight connections and attachments. Um, so the concern for this population lies in the abusive environment that negatively impacts their development. So moving on to gaps. Lack of direct observation to compile data related to change in the parent and child behavior regarding parent child interaction therapy, PCIT. So, um, So in that study of the PCIT therapy, um, there is kind of like a lack in the observation that they use to collect data. Then also the correlational design of the family relationships and PTSD study. Um, it does not allow us to determine causal or directional effects. So in other words, we don't know whether weak father-child um, consistency leads to PTSD or if a child's PTSD leads to a weak perception of the father. Um, Moving on to the application integration portion, adverse childhood experiences, also known as ACEs, negatively influence a child's development. Intimate partner violence is one of several ACEs, and ACEs. There's so many ACEs, such as having a parent that's incarcerated, neglect, physical, mental abuse, verbal abuse, things of that nature. So, in a 2019 study, researchers analyzed risk propensity and sensation seeking in adolescents and young adults aged between 18 and 25. Um, and in that study, they the results suggested that um, young adults aged between 18 and 25 that have been exposed to intimate partner violence um, have a have less of a desire for sensation than young adults that have been unexposed to IPV. So, in a social context, adverse childhood experiences lay um, the foundation for early relationships and social connections, trauma prevention and treatment is critical for healthy development regarding the child. Um, so, moving on to the intervention process, the parent child interaction therapy. Traditional PCIT has been tested extensively. Various treatment outcome studies suggest improvements in parent skill and child behavior. Um, there are two phases of this type of therapy. So there's child directed interaction, CDI, and that concentrates on the relationship enhancement between the child and parent. And then the second phase, that is parent directed interaction, PDI, and that targets effective discipline and limit enforcement. Limits enforcement, sorry. According to the social learning theory, there are intergenerational effects of IPV. This includes both biological and sociocultural factors. Um, so, although PCIT has positive outcomes, there are differing results for children that do not have the access for the treatment or access to the treatment. They may develop a decreased desire for sensation, which includes acts such as touching. So through analysis of the research, um, through analysis of the research depicted resilience as the ability to display healthy social interaction, optimism, and emotional regulation. That's just basically saying that through healthy social interaction, optimism, and emotional regulation, um, between the parent child, um, the child's more, it has a good potential for resilience. So through appropriate and positive treatment, a child has high potential for high resiliency. And resiliency is like them bouncing back. It's like despite adverse childhood experiences that they undergo, resiliency is um, seen as the child working through that and overcoming it. So therefore, when a child interacts with their mother, resiliency becomes more obtainable. Moving on to the conclusion. So due to a large number of children affected by traumatic symptoms in the sample, it seems valid to systematically diagnose post-traumatic stress disorder in the children to offer specific treatment. And that's from the 2019 study. And it is important to consider these studies' insights as they're relevant to the growing problem of intimate partner violence and its impact on children. And lastly, the implications for future research. Further research should consider longitudinal studies spanning from preschool age children to young adulthood. This would accurately reflect the developmental impact of IPV on children. And then also with IPV gaining increased recognition, there should be a wider range of studies concerning mental disorders that could present themselves later on in a child's life. And my references are at the bottom. Thank you for your time.